majority for this motion because it allows us to discuss this very important issue. And Minister, I want to spend my 4 minutes focusing on the more local impacts of government policy in regard to healthcare. And really I want to concentrate on the impacts on Sligo University Hospital, because that's what matters to the people living there, because that's their local hospital. So what are we talking about? Last week, healthcare workers took time out to make the case for patients at SUH. Staff are carrying a huge workload, partly due to the HSE moratorium on employing staff, and that has a huge impact on patient experience, but also on the staff delivering the service who are burnt out at this stage. But Minister, it's not just now. Last December, workers left their posts at SUH to highlight the same concerns. And Minister, if we don't listen to the healthcare workers in our hospitals, then we are not facing up to the reality of what's happening. And they tell us that the HSE pay and number strategy will have a detrimental impact on services. And SIP2 is telling us that certain areas are being left behind in terms of adequate staffing. And Minister, that's my main concern, because we must have a safe staffing framework for all grades and areas in the health service. Just 2 years ago, Minister, 50 consultants from Sligo University Hospital wrote to the Taoiseach about conditions for staff and patients at SUH. They said the working conditions were unacceptable and unsafe, and it was unsafe for patients also. One consultant said, "I have worked as a consultant for over 17 years and I have never seen the demand on our services so high, nor the morale of our staff so low." And Minister, one of the reasons for that is that in the wake of the 2008 economic crash, Sligo University Hospital lost 60 beds. 60 beds, proportionately far more than any other hospital in the country. Yes, there's a 40-bedded unit that is due to start construction soon, I hope. That's great. But that even won't bring us back to 2008 numbers. But it's not just the local consultants, the local staff. What are the Irish Hospital Consultants Association, the national body, saying? 3 years ago they said, meeting the healthcare needs of the 152,000 people in the West and North West regions currently waiting to be assessed or treated by a consultant will only be possible by urgently filling permanent vacant hospital consultant posts. 1 year later, in 2022, the same organisation, a national organisation, said failing to recruit consultant medical and surgical specialists in the North West will inevitably lead to patient harm and poor clinical outcomes. And Minister, the truth of the matter is, because there is no Model 4 hospital north of a line from Dublin to Galway, there is huge difficulty, no matter what money you pour into it, in recruiting consultants. That's the reality of it. The rest of the country has their Model 4 hospitals, their specialities, nothing north of that line from Dublin to Galway as far as the Model 4 hospital is concerned, and that's contributing to it. And finally, the last point I want to make is, and I've had discussions with Minister Donnelly about this, and he said sometimes he disagrees with my figures on those patients in hospital waiting for beds, trolley watch. Well, I would just use two figures. In 2014, 10 years ago, there were just over 2,000 people, 2017, waiting on hospital beds in the hospital in Sligo. Last year, there were 8,193, almost quadrupled. Minister, if that doesn't tell you that there is a severe emergency where Sligo University Hospital is concerned, and if you don't listen to the national body of consultants, then I don't know what's going to happen, but you must listen, because the people in the North West matter as much as the people that you and every other deputy in this House represent.
I call now on Deputy Violet N.